E-cigarettes represent possibly the most polarising issue in contemporary public health. And some people they're seen as a solution to the ills of tobacco. We don't really know how harmful e-cigarettes are yet, but it seems likely that they're going to be proven over time to be much less harmful than tobacco. So if all smokers were to switch to e-cigarettes rather than smoking tobacco, there would most likely be large, kind of significant public health gains to be achieved from that. Other people are somewhat more sceptical of e-cigarettes, pointing to concerns in particular that they might renormalise smoking behaviours, or they might act as a gateway into smoking, particularly for young people. At the moment, neither of those positions is really based on very much evidence. E-cigarettes are quite a new technology and they're rapidly changing. The landscapes in which they're bought and sold are also changing rapidly. So research is needed to understand the potential harms and benefits associated with e-cigarettes. Our study examines the prevalence of e-cigarette use among young people aged 10 to 16 years in Wales. And we used data from two surveys, the Chets Wales 2 primary school based survey and the secondary school health behaviour in school aged children survey. And in total we had about 10,000 young people taking part. We found that amongst younger children, experimentation with e-cigarettes was actually more common than experimentation with tobacco. Although over time tobacco becomes more common than e-cigarette use amongst the older age groups. Overall, about 12% of secondary school aged young people had used an e-cigarette at least a few times, which is comparable to the prevalence of having used tobacco. Although regular use of e-cigarettes was quite low at 1.5%, and that 1.5% was limited almost exclusively to young people who also smoked. And among young people who had used an e-cigarette, the percentage who tried tobacco or were current smokers rose rapidly with age. So, for example, at age 10, less than 10% of children who'd used an e-cigarette reported that they also currently smoked tobacco, but by age 15 to 16 that had risen to about 40%. And that strong association of current smoking with e-cigarette use suggests that young people aren't using e-cigarettes as an effective way of giving up tobacco. We also show that at secondary school age, e-cigarette use isn't patterned by a lot of the sociodemographic factors that you'd expect to see smoking being patterned by, so things like sex, socioeconomic status, race. So e-cigarettes do appear perhaps to have something of a more universal appeal to young people than tobacco, and it seems likely that many young people who are experimenting with e-cigarettes wouldn't otherwise have come into contact with tobacco. And there are limitations to our data, of course. The surveys are cross-sectional, we only collected data at one time point. They're also based on self-reported measures of e-cigarette use, which aren't yet validated. We don't really know what comes first, whether young people use an e-cigarette first and then move on to smoking, or whether young people smoke first and then use e-cigarettes. But our findings do kind of point towards a need for more longitudinal data to explore those issues more thoroughly. At the moment, there is a need for policymakers and practitioners to be concerned about young people's use of e-cigarettes, perhaps particularly given recent investments by the tobacco industry in this market, an industry that does have an established track record of targeting young people with their products. But at the moment, the low levels of regular use of e-cigarettes amongst young people do seem to suggest that there is no need to panic that they're currently getting young people hooked on nicotine.